Hello, my name is Robin Pinchton. I'm a nurse practitioner. I'm here today to discuss advocacy. And thank you all for coming. We're going to spend the next 30 minutes or so just discussing what advocacy is, how you can be an advocate, and ways that you can best advocate for whatever issue that is concerning to you. So what is it? What is advocacy? Just the basic definition of advocacy is here on the screen for you to read. Advocacy is defined as any action that speaks in favor of, recommends, argues, defends for a cause, supports or defends, pleads on behalf of others. It involves promoting the interests or cause of someone or a group of people. An advocate is a person who argues for, recommends, or support a cause or policy. So that is the basic definition. How do I fit into this? Here's my background. My background is I'm a family nurse practitioner, been in healthcare industry for over 35 years. I own my own business. So I'm a female business owner in Georgia and a nurse practitioner. I focus on elder care, seniors, do primary and chronic care management of the elderly. I do psychiatric, medical management, do a lot with dementia. And I started my career as a registered nurse in the burn unit at the University of Kansas. So I'm a very passionate advocate for healthcare for Georgians and for nurse practitioners. A few things, avenues I do to promote or use for my advocacy is I join my professional organizations. And those organizations that I belong to include United Advanced Practice Registered Nurses of Georgia, which I am a vice president. I'm co-chair of the Government Relations Council for UAPRN. I'm the Georgia Gerontological Advanced Practice Nursing Association State Secretary. I'm also a registered lobbyist for the state of Georgia. I spend a lot of my time at the Capitol. So what got me into advocacy? I think as a nurse at heart, we're always advocating for our patients. We're always trying to get the best care to make sure that they have the right medicine that they need for whatever it might be, have the right resources. And that just kind of blossomed. And then I had a child who has special needs. And for those of you that ever have a special needs child, we are fighting and advocating for them every step of the way to make sure they have the right resources, the right access to care. And that kind of triggered my advocacy journey. And then as I became older and my children left the nest and they went to college, I started giving back to my profession. And I became really involved with healthcare policy. And that's what I do today. And I spend quite a bit of time doing it. And I love it. I love going to the Capitol. That building just excites me. When you walk in, it's just very exciting. You just feel so much power and all the history in that building. So it's very, really creates a lot of energy for me. And it really helps with my advocacy work. So advocacy at work, what is it? So you create a policy or changes as a result of citizen lobbying. And remember, we advocate for everything. We advocate for our lights, our water, transportation, food, healthcare. Everything is lobbying and advocacy. We need to increase public awareness of an issue that we're trying to advocate for. The uplifting of voices and concerns of impacted people and formation of solidarity and coalitions, that's advocacy at work. We're trying to get people together on a focused concern to bring about positive change. And then we share the research results with the community so they can demonstrate to agencies to back up their concerns, and they can lead to changes and to access new resources to meet those needs and concerns. So some things that you might be seeing in your neighborhoods or around in your life that might need change, and might need some advocating. Think about an unsafe intersection where you see so many um, car wrecks or unsafe pedestrian crossings. You get together as a neighborhood or as a community, and then you go to your Department of Transportation or your local city council folks, and you identify the need, and you come up with a plan to correct it. Other areas of advocacy for what we do in healthcare is lack of access to fresh food. Food deserts in some of our areas in Atlanta, lack of access to a pediatrician, which our rural Georgia folks have that issue as well. Medications are too expensive, especially insulin, right? We try to get together to identify an issue, see if we can decrease that cost of insulin or any other medication that is so expensive that our patients can't afford and exacerbates their chronic illness or makes their diabetes worse. So you increase public awareness. All right. So this is called power mapping. This is a way, it's just a platform that you look to see how we can work to advocate for a specific goal. So what do you do as a group? And it can either be your homeowners association, it could be, you know, if you're working together for a community cause. What do you want to achieve? You need to make a very clear, concise goal of what it is you want to achieve. You write it out. And who can we work with to achieve this goal? Who is the best person to help you get this goal accomplished? If you're looking at an intersection that needs to be addressed, do you go to the county commissioner? Do you go to the Department of Transportation? So you need to do some research to find out where is the best place to go to achieve this goal. Who needs to be engaged? You look to see who are the best people to get involved with your issue so you can have a positive outcome. Are they connected? Are they well networked? This is what I'm doing right now. I have 2 work groups going within the state. We're tackling 2 issues that are very important to Georgia healthcare, and that is we are now signing death certificates as nurse practitioners. That was a law that we had passed this year, and now we're forming a workforce to make sure that gets implemented across the state. And I'm pulling in people who have the ability to sign death certificates, who have the ability to or understand the GABR system, which is the Vital Signs Statistic website for Georgia. And we're pulling everybody in so we can use all those resources to have a positive impact. And what stories do we want to uplift? So what is your positive impact? What are you trying to accomplish? So say it's the traffic intersection. You will get your data from the county or the city to see how many car accidents have occurred, if there have been any pedestrians injured in that intersection. Does the trees and weeds need to be cut down so they can improve sight? So you get all your data collected so you can present that as your platform. Okay. So after you identify what it is you're trying to do, what is your goal? What is the issue? What is the problem? How do you start getting out your grassroots effort? How do you start working on the advocacy for this? You have to figure out who your target audience is. So you want to involve either your legislators or city council folks, your mayor. You have to figure out who the best person is that can help you solve this problem. And the other thing, don't forget that you have to do to advocate is you have to vote. You have to be registered to vote. Legislators do know who vote, and they know who do not vote. So that's a very powerful tool when you are talking to your legislators or your mayors or your city council folks. Other issue is how do you reach these folks? You can email, do a petition. If you need better access to special services at your school for your folks, your kids with ADD, you get a petition together, you gather all the parents together that have kids with special needs, and you sign a petition for what you need. Call your legislative line, meet with your legislators, form alliances, form working groups, organize community meetings or town halls. You can meet at the public library, it's free. And you can connect with the media as well to get your word out. Once you identify who your legislator is or who the person is that you want to talk to, you want to try to meet with them in person if you can. You schedule a meeting. Remember, these folks are very, very busy. You want to meet for maybe only expect maybe 15 minutes. You might get 10 if they're available and not very, very busy. Right now, most legislators, it's an election year. The primary was just over, so now they're gearing up for the general election coming up in November. So this is the time they do want to talk to their constituents. This is the time where they want to listen to your issues, and you can have an impact saying, I want you to be a voice for my issue, and I want you to legislate for me if I vote for you. So here in Georgia, our legislators are very available. You can see them out and about. They go to very many public events, meetings, call their local office. They all have a local office. You can go onto the Secretary of State's website to find your legislator. There's a place there that says find your legislator, and you put in your zip code and your city, and it will pull up who your legislators are, your representative, your state representative, and your state senator. It will also pull up your congressional legislators, your senator and your congressman or woman at the federal level. It will also pull up your mayor and any council folks. So when you email or call the office, you ask that you want to request a meeting, give them some time, need about 2 to 4 weeks. Let them know your issue, what you want to discuss. There may be a bill or a piece of legislation already introduced to the House or Senate, or it might be an issue that you want them to write a bill for. Just reference what it is that you are wanting to discuss. So it might be a Zoom call, it might be in person, it might be a staffer. When I go to Capitol Hill in DC quite a bit, the actual congressman or senator, he might be too busy to come out, so we meet with their legislative staff. I usually meet with their staff who are very well versed in healthcare. And we share our concerns, and they will relay those concerns on to Senator Ossoff or McCormick or whomever it is we're meeting with. Okay, keep things brief. You also want to make sure that you have correct data. Anything you're presenting to legislators or elected officials, you want to ensure is accurate, it's correct, and you're able to reference where you found that source. Okay, just not Googling stuff on Google, that does not cut it. It has to be hard data that is accurate. Okay, it's very important, and they're going to listen to you if you are their constituent, because you actually employ, you are their employer. They're employed by you. You voted for them, so they want to work for you. They want to hear your issues. Just as a side note, when an organization sends out a blast, thousands of emails to every single representative in the state of Georgia, or the United States, they only look at those letters sent by their constituents. So it's very, very important that you as a constituent connect with your legislator. They're also going to look to see if you're registered to vote. Be mindful of the time. State your facts. Don't be argumentative. Be passionate, but don't be angry or short or too impactful. Make sure you leave room for questions. And they do like one pagers. They like to leave behind, but they don't want a 5-page leave behind. They would like something that's short, just speaks to the facts, 1 page. They like visuals too. So for example, I usually put maps when I leave 1-pagers. I compare Georgia to the rest of the states in the country and where we sit for an issue, say signing handicap stickers. That was something that we legislated and advocated for this year. We were one of 2 states where nurse practitioners could not sign handicap forms. And that was a bill that was passed this year. So now we're able to sign handicap forms, which is helpful. And helps our handicap folks get those forms, the handicap placards, a lot quicker than before. But I showed a map, and I showed a map that we were red, us, and it was South Dakota, and all the other states were green. And that was it's a very visual impact. Okay, so dress well, make an ask. I would like you to look into this issue. I would like you to write a bill for this issue. And thank them for their time. And again, leave the 1-pager behind. So that's the basics of advocacy, of how you can do it. I'll just briefly touch on some of the healthcare issues that we advocated for this session that impacts you as a Georgian. Specific to healthcare, what we did, as I said, we did pass legislation that NPs, nurse practitioners, and physician assistants, we can now sign death certificates. For those of you that might have had the unfortunate instance of losing a loved one, you may have had the experience of death certificate taking a very long time to sign, up to 3 months. And this is very impactful to the family left behind because they could not touch the assets. They could not get access to life insurance. And the issue is that our docs are just so overwhelmed with paperwork that they just could not do it in a timely manner. So I spoke with the senator who was aware of the issue. He was working on the issue as well. And he agreed that APRN should sign death certificates. And then we bonded together. We went into his death certificate committees, the Senate level. We met with all the parties that were involved in this issue. We asked a representative to write the bill. He did write the bill, and then it moved through the legislative process. So he was a representative. It moved through the House. From the House, it moved through the Senate. It was passed the last day of the session, and Governor Kemp signed that bill on April 30th. So now we're implementing that July 1st. The other issues that we advocated for and passed, as I mentioned, were that nurse practitioners and PAs can now sign the handicap forms, the placards. So that will make it easier too, if you have a loved one who needs that handicap form in their car. We now have availability to sign those, so maybe you can get them quicker. Another thing that we legislated for and advocated for was for nurse practitioners and PAs to sign a prescription for Schedule II emergency drugs, which is a hydrocodone product. And why is this so important in Georgia? In Georgia, we have 75 counties without an ER physician. We have 45 counties without an internal medicine physician. We have, I believe, 50 counties without a family practice physician. So most of these rural clinics are staffed by nurse practitioners and PAs. So if you have somebody coming in who fell and they broke their arm, they come to your urgent care or broke a clavicle, you're able to set that arm in a sling, and you can get them a 5-day emergency supply of hydrocodone until you can get them into an orthopedic, which might be 2 hours away, or they may not be able to see them for 3 days. So that's very, very important for care of our Georgians as well. The other, couple other things, that passed as well. There was also the, start of a commission for women and children on maternal health. And this is very important because in Georgia, we have the highest maternal mortality rate, which means that our moms who give a birth to a baby, they are dying at a very high percent, and that needs to be changed. So this commission is going to look at the factors of why this is happening, what interventions we can put in place, what resources can we give, so we can really change this terrible number. So those are a few of the things. Thank you so much for your time. There's my email if you have any questions. Please feel free to reach out. Thank you.